The doctor is in. Not sure where the doctor is tonight. Hopefully she'll be here. Dr. Mo's probably running around doing something with patients, and hopefully she'll be here with us. But I have like my good precious friend Deneen here today. Deneen Ciccone. We've been trying to do this show for a while, right?
We
We've been
have.
talking about it since last summer, right, girl? And so she is just a force to be reckoned with, especially in the policy space, which we'll talk about because I don't think a lot of people understand what that means and what that means in the cancer world. But her organization is called Cancer Support Community, and that's what they do. And so I would love for you to just share all the things that you guys do, because you think about what does cancer support look like, and you guys can check all the boxes, right? And I'm not sure how many people actually are aware of what you do, and then specifically again what you do kind of for Black people. So talk about what the organization does. Well, introduce yourself because you're my precious friend with two
Oh, thank you.
and
Thank
a
you,
puppy and a
Ricky.
cute puppy, and
Yes.
and we'll get into what everything all the other good stuff you do.
Yeah, thank you so much. So I am Deneen Ciccone. I am the Vice President of Policy and Advocacy at Cancer Support Community. So that means I work with federal and state lawmakers to amplify the voices of all people impacted by cancer, to make sure that any policies that have an impact on people impacted by cancer, that's patients, caregivers, or survivors, that their needs, preferences, wants, and perspectives and perceptions are included in policymaking so that it's always patient-centered, like what matters to the patient in healthcare policy. So that's who I am, and that's what I do. Now, Cancer Support Community is a nonprofit that
Stop for
provides,
1 second. Stop for
yeah.
1 second. Break it down even further. What is policy?
Oh, of course. So policy is like rules or laws that federal governments or state governments pass, right? With their state legislators. We all have a state legislator or a federal legislator, like you hear, member of Congress, right? You're probably hearing a lot in the news right now about what's happening in the member of Congress. We had the elections, there was a big change and a shift in the members of Congress. Right now, it's much more Republican leaning. And so there's a lot of discussions now on like, what will policies look like with the shift and the change, right? So these lawmakers that we elect, which is why it's so important that we participate in the lawmaking and the voting process. These lawmakers determine what laws should look like that impact, any jurisdiction that they might have on their committee. And so in healthcare, when we talk about health policy, that's huge, right? Healthcare is a major part of our gross domestic product. So just as an issue, it's ginormous and it has a lot of influence. And so when we talk about policies like the Affordable Care Act, you might know about the Affordable Care Act, which was implemented by President Obama, that expanded access to insurance coverage for people who were previously uninsured. And you might hear about like states that are expanding Medicaid. Again, Medicaid is to allow people who may be at a certain income level to be able to afford to have access to that insurance coverage. That's one example of when we say policy of what we mean. But health policy touches everything. It touches vaccinations, it touches screenings, it touches prevention, it touches hospitalizations, what an insurance company will cover, what a doctor will provide. So you have a voice, right? In policy making, because healthcare touches all of us, and it has such significant importance in lawmaking that it behooves you where it makes sense for you to be involved in the conversation. Because again,
Right,
I'm here to ensure that these policies really reflect what matters to patients, to people like you and me.
right, right. And I think the world knows most about policy when we experience COVID.
Mhm.
It really was not only a health issue, it was an economic issue. So many people, were out of work, or lost their businesses. So
Yes.
even like I mean, I hate to say everything boils down to money and life and death, right?
Mhm.
But that's what kind of is covered by everything here, right? So it's all in there. So cool, cool, cool. All right, keep going. Thank you.
No, yeah, absolutely. So yeah, so Ricky, she's right. Economics plays a big part in this. When we talk about economics, economics can play a big part in who has access, right, to healthcare, who has access to services. And that's a big part of what I do in the policy and the advocacy space, is just make sure that those barriers that might have kept people out or made it harder for them to receive access to services or even understand what their treatment options might be, because we do know, like, evidence really shows that what they call like social economic factors, that can be a barrier. And some people who may not have the financial resources, or as others may not know that certain things are available to them, or they may actually delay getting access to treatment, right? So I really work to make sure that those barriers that might impact certain communities more than others, those are addressed through policy making, like I just talked about, right? So that everyone, all people, have equal opportunity and equal access to participate in and receive healthcare services that they need, because no one wants to have a sickness or an illness and then not be able to access or afford the treatment and the services that they need, and even for their loved one as well.
Yeah, it's even like, and I think so many of us don't really think about these kinds of needs until we're in a crisis.
Exactly. And
Right.
that's why I'm here, right? That's what I'm here to do. I'm here to think big picture of the healthcare ecosystem, from a patient centricity approach, meaning the patient is at the center, we are at the center, and then we create those policies that support us, be it through the physical needs, right? Maybe the immediate impact of a treatment or a condition, but also the social needs, like your community, any economic needs, any mental health or emotional needs, right? Financial needs, and even spiritual needs. Like, all of that is important. And I'm not saying that we want Congress or we want lawmakers to describe everything that we need to do, right? Because we don't want them to direct. We
Right.
want that freedom. But what
Right.
I'm saying is we want a system that factors in that we're not monoliths, right? And that there are so many factors outside of health that impact us. And let's make sure that when we think about healthcare, like, we're thinking about what touches people, those factors that touch people, and that they inform the policy making that we're doing, so that if someone is impacted by a condition or an illness or needs medical treatment, they don't have to worry about the what ifs, because the system, I feel like it's our duty, right? Our responsibility as a community, as a nation, to support each
Yeah.
other and make sure we have the supports that we need so that we can function and thrive and participate in our communities and with our families.
Yeah. And we all sort of feel like, people are lacking. They don't even, and people don't even know what they don't know, or what
Mhm.
they don't need until, they're stuck. So give me some examples just of like some of the services that you guys offer, like to help
Yeah,
younger.
right. So, cancer support community, like Ricky said, the name says a lot. We focus on providing what we call free psychosocial and emotional support services to everyone impacted by cancer. Like I said, that's a patient, that's a caregiver, or a survivor. And we do that by offering services, resources, educational programming through our network partners. So I work at Cancer Support Community at the headquarters, right? But what we do, it's not done by the people in the headquarters. We have over 196 internationally, when you add international, but primarily
Really?
in the
Wow.
US. Yeah, we have over 190 locations in the United States alone
I didn't
that,
know that. Really? Wow.
yeah, that we provide this type of support needs to the community, based on like what the community needs, right? So we try to be very much reflective of the needs of that community, and that's how we do it, because we were created. So just to kind of give you guys a little bit of background of like how Cancer Support Community came to be. Cancer Support Community came to be in 2009, but the entities that make up Cancer Support Community existed way before then. So Cancer Support Community came to be through the wellness community that was founded in 1985 in Santa Monica, California. There was a doctor who, his wife was unfortunately diagnosed with cancer, and he realized, you know what, my wife, as she's undergoing treatment, I'm understanding what she needs and what's missing is like that emotional and that support. Like, are you okay? You're not alone. Here's a community of other people who might be experiencing this. Here's some educational events you might be interested in. Here's some meditation. Here's some yoga. Here's some spiritual. Here's some nutrition, right? Ideas on how you can eat healthier. So he created the wellness community in 1985. And I don't know, for those of you who are a little older like me, you may have heard of the Saturday Night Live comedian Gilda Radner. Well,
Gilda.
yes, yes. So Gilda Radner was actually diagnosed with ovarian cancer, and she received those psychosocial, what we call psychosocial community support services at the wellness community. And unfortunately, I think we all know, those of us who know Gilda Radner, she passed
Yeah.
away. And in her honor, her husband and like really close friends created what was called the Gilda's Club, which was to continue and augment the work that was being done at the wellness community because they recognized how much that benefited her. And that was created in 1995, right? And so in 2009, the wellness community and the Gilda's clubs came together and became what you know today as Cancer Support Community. And so what
I didn't
we
know
are
that
here to
before.
do
Yeah.
is to focus on providing, like I said, that mental health, that psychosocial, that support, that community services that people need as they're going through a cancer diagnosis and journey. Because sometimes we recognize that people need hope. We recognize that people need to be strengthened by their community. They need resiliency. And, sometimes people don't want to just always sit there and think about the physical, right? They want to be empowered. Like, what can I do? I'm in charge as to the extent that I can be, that I'm in control, that I'm not alone, that I have a community, that there are resources out there to help me understand that it doesn't end here. Or if I'm angry, if I'm alone, if I have all these questions, there are
Right.
people out there that I can talk to that can hear me. And while our cancer support communities oftentimes are staffed with like social workers, we oftentimes refer to like licensed psychologists or other mental health professionals to provide that type of treatment.
And nurturing
But
care. Yeah.
yeah, but that's why we're here and that's why we exist. And like I said, we provide all of these services for free because the last thing someone needs to worry about that is dealing with a cancer diagnosis is how am I going to pay for that? And you
How am
should
I gonna
not have
pay
to think
for it?
about
Right,
that.
right.
Yeah.
And we're not getting, and I mean, we provide nurse navigation, and it's kind of
Mhm.
like what you guys are doing are providing similar kind of resources.
Exactly.
So if I were a patient right now and I wanted to reach out to get some care, what would I do to reach you guys?
So there are a couple of ways. So you could go to our website, cancersupportcommunity.org, and you can contact our helpline, right? So if you're not so sure you want to actually contact a physical location, we have a helpline. It's a toll-free line that's available. The number is 888-793-9355. And most of our helpline counselors are social workers. And we have some navigators, financial navigators as well. And you can call them and you can talk to them. Now, again, they won't provide like that psychological or mental health support, but they are an emotional support. They are there to listen. And what they can do is when they listen to you, they may be able to recommend some local resources in your community. Oftentimes people may contact them and it might be about one issue, but in talking to people, they may identify, you know what, you might be able to have some supports here related to lodging, some supports here related to childcare, or maybe you may want to think about some treatment decisions. Let us send you some information so that when you go in and you talk to your care team, you can, ask some questions about your treatment and feel like you're more involved. So we're
Right.
real, and we even provide like, pediatric oncology support. So that's one way, right? Call our helpline.
Can you give me
And
that number again? I was
yes,
in the comments. Tell me it again.
888-793-9355.
888-793-9355. That's a great number.
Thank you. And we also provide, we also have a Spanish speaking
Great.
resource specialist as
That's
well.
also great.
So that's one way, right? You can call our helpline. And if you don't want to call a helpline, you can go on the website and there's like a web-based function that you could use, right? Where you could
The
kind of
triage
like,
yourself, okay.
yeah, like type in your information if you don't want to be on the phone, because we want to
Mhm.
meet people where they are. We understand
Yeah,
people may not want to actually speak to a live person. And if you'd rather, communicate via, entering your information online, you can do that as well. And in real time, be connected to someone. So you have our helpline. I also mentioned,
yeah,
we have our network partners and affiliates throughout the nation. I live in the DC, Baltimore area, right? And we have a CSC DC location, which is one example that offers like online support groups. They work together with the community to do some screenings, right? Screenings related to like lung cancer or breast cancer. So you can go on our website, enter in your zip code, and find the nearest cancer support community or Gilda's Club
right,
closest to you. Find out what events they have happening in your community. And if maybe you know someone who might be going through a cancer diagnosis or journey and you think, this information might be, helpful to them, please share it
right,
with them as well.
right. That's great. That's great. Um, do you have any, you kind of reach everybody, you're speaking Spanish. Is there anything specific for Black people or that even Black people should know about in our community?
Absolutely.
Because,
Yes,
I truly
absolutely.
believe we have different cancer, right?
No,
I,
no, but we no. But we do serve. Like I said, we serve all people
okay,
impacted by
yeah,
cancer, right?
okay,
So absolutely, we have resources for Black and African Americans. So we have some resources for Black and African Americans related to multiple myeloma. That can help them through their journey, their diagnosis. We also have peer support specialists, for instance, if a Black or African American individual is interested in thinking about entering a clinical trial but has questions, we can connect them with a Black or African American clinical trial participant that can like answer their questions. Like, what was it like for you
awesome.
participating in a clinical trial? So those are the type of resources that we offer for Black and African American individuals. In addition to, like I said, we have our cancer support community locations. I didn't mention, we also have a mylifeline.org, which is a digital online community that you can like sign up and create your own community, right? It's like a dashboard where you can enter in your demographic information and be connected. Again, you tailor it to what you're looking for. You can look for other people in your area or that might have a similar diagnosis or similar demographic and be connected with the community through mylifeline.org, because what we do know is that a cancer diagnosis can be extremely isolating and people
Yeah,
can feel lonely. And the last thing we want anyone to feel is that they are alone. So I would also recommend looking at mylifeline.org and getting connected to groups and communities that may be created and tailored for Black and African American individuals. So that's what we're doing at Cancer Support Community
oh, great.
for the community. Now, me
This
as
is all
Deneen,
so great, though. Take a breath for a second. This is all, I know, you're like,
yeah, it's a lot. It's a
it's
lot.
a
You got me on
lot,
a
but
roll here.
I know, but it's great. I mean, it's kind of like navigation, it's services, it's health, it's mental health, it's all the things that you could possibly need, and it's a great resource, so, and you can have a hotline to call somebody, you can
Yeah.
go online and have access to it, or you can connect with the community. How cool is that? And meet other survivors.
Yes.
I need some water, my throat's dry. Everything is so dry in this crazy freezing weather.
It's because it's so cold and
It's
you
so
have the
cold.
heat
Yeah,
on and
yeah,
the air
yeah,
is dry
yeah,
and
yeah. Keep
I
talking.
have
I'm
my
gonna get
water.
some water. I know, get some water. I have to get for the show.
Yeah, take your time. I'll take some water myself.
Denise's in DC where I'm close to, and it's gonna go up to 31 tomorrow. My Alexa is talking right now. Oh my gosh.
That's
31.
amazing because
I know,
31 is going to feel like 55.
I know, because it was 6 this morning when I went out.
Yes, it was so cold this
So
morning.
cold,
It
cold,
Yeah.
yeah.
I
everybody,
always
oh,
feel for people who don't
yeah,
have housing in this type of weather.
I know. I was on a call this morning though from somebody, they were talking about their moms in Louisiana and she got 12 inches of snow,
I
Louisiana.
know. And they don't get that type of snow. So this is like, this could be like once in a lifetime for people down in the South.
I know, but you're so right though. Who doesn't have housing? Who's on the streets right now? Who's like, you're not on the streets, hopefully you're in a shelter. But I mean, this is a time when, what, we have our friend Z in Oakland and she's a navigator, one of our navigator friends. And she says, when people come to me, first thing I ask them is, where'd you sleep last night? When was your last meal? Where are your kids? Before you can even get to talking about cancer, so
Exactly.
it's so great for you guys to be able to at least have these opportunities or these basically things available for people to, use your services. So
Absolutely.
you're great. So keep on going. I'm sorry.
Oh, yeah, for sure. And so what I was saying, and I'm glad you were like interject so we can like make a clear delineation because there's so much to be done in this space. And I hope everyone can feel like the genuine passion, that I have
Yeah.
for what I'm doing, right? So I was sharing that, as policy and advocacy lead for a cancer support community, and some of the work that we do related to supporting Black and African American individuals, specifically, excuse me, is related to clinical trial diversity and clinical trial representation.
That's my lane. And that's how we
I
kind of,
know it. I know. I
right?
know.
Yeah.
So
Yeah.
we can really talk about, that. So we're doing some work to like really break down those barriers and increase understanding and encourage communication between Black people and their medical care team so that they can decide, is a clinical trial right for me? And is this something I want to consider? And how do I enroll? And that's one of the questions that our helpline asks, right? But at a policy and advocacy level, what we're doing at CSC is we actually, we recognize that there is an urgent need for more representation of Black and African Americans in clinical trials, particularly when there are conditions or there are treatments being developed and the proportion of the population that's impacted may not be reflected in the clinical
Right.
trial. So
Right.
what we've created is a docuseries that I would encourage everyone to look at. It's going to be 6 parts. 2 are filmed. We're filming the 3rd one now. The first, it's called Justified Medical Mistrust, Acknowledging the Past to Correct the Future. And the first,
Justified medical mistrust.
yes, Justified Medical Mistrust.
Great.
And the first video that we filmed in our docuseries, Dr. Mo was actually in our docuseries.
Oh, really? Okay. I didn't know that. Awesome.
Yes, it was called How Does a Clinical Trial Benefit Me? And so we had an actual breast cancer clinical trial participant. We had Dr. Mo as an oncologist share, right, why it was so important. And we had that individual who participated, basically kind of breaking down some of those myths and saying, here's why I made the decision. Here's how a clinical trial might be useful for me, and like really empowering Black Americans and African Americans and other Black people with that information to understand that it's not the boogeyman concept of participating in the clinical trial. That was our first video. How does a clinical trial benefit me? The second video was Righting the Wrongs. And that one was looking at some of the systemic barriers and reasons why Blacks and African Americans may have been reticent or reluctant to participate in clinical trials, right? And acknowledging that there were some real systemic inequities and problems in the system that created Blacks and African Americans, rightfully so, not trusting and wanting to participate. So we shot that docuseries acknowledging, right, like here's the history, but here's what we can do to fix it and move forward. And the third video that we're filming now is called Myths versus Facts, 2 sides of the same coin. And that one's really delving into some of those myths about clinical research and clinical trial participation. And it's all through the lens of educating and empowering Black and African Americans. And each video is between 12 and 15 minutes. So if you haven't, I would encourage you to go to our website, Cancer Support Community, Justified Medical Mistrust, but I can also follow up with Ricky and get her that information. But we're really working with some policy solutions to break down those barriers so that Blacks and African Americans have the opportunity to participate in clinical trials. So that's another example of what we're doing at the
That's
policy
awesome.
level.
That's awesome. So we will definitely put those on our social media and try to get
Wonderful.
traction for you. We'll post those on our social media and basically kind of highlight what you're doing because that's so important. This is our
Wait,
link.
Vicky, you're doing so much, and I don't want to put you on the spot, but you are
Um,
a leader in this space.
we're trying, and it's so funny. It's really been 3 years this week that we launched. We launched when we trial actually January 29th and 3 years ago now. And so I just looked at our numbers yesterday. We've now sent 22,645 Black women into our clinical trial portal.
Amazing.
And
That's amazing.
I'm proud of that number, but it's not enough. It's not enough. And when you talk about where it needs to be, and it really needs to be not only commensurate with the population. So if Black people represent 14% of our population, it needs to be commensurate with the burden of disease.
Yes.
So when I start thinking about, triple negative breast cancer that Black women get at 3 times the rate of white women, in those trials, which we're working on a bunch now, which I'm so happy about, we need to get those kind of numbers. We need to get, bigger numbers to represent
Yes.
who's getting this disease. And that's what we're working on. So we've been, thank you God, so blessed now to be working on a bunch of trials to help our pharma partners recruit women. And, guys, if you need a trial or you need someone who knows a trial, you better call me, email me, text me. You all know how to reach me, Ricky@touchbbca.org, because we are now trying to recruit for these trials and get the numbers that we need. But Janine, the FDA put out this number. It's been a few years now that Black women represent 3% of clinical trials in breast drugs. And so every time I ask somebody at the FDA, well, what does that number stand for? Like, what's the number in the denominator? Like, how do you create that fraction of 3%? So I can compare, like, what should the number be to build a goal? No one can explain it to me, which is pretty pathetic. But okay.
That's interesting. And I
Yeah,
would love to understand more
you
about
can
that.
figure that out, dude. I'll be your best friend. Oh, I'm already gonna be your best friend for life, but I'll be your best friend. No, I've asked so many people at the FDA, and if you Google it, you'll see that it says the number comes from the FDA, but no one can explain it to me. So I'm trying to have some point of reference for our 22,645 women. What does that really mean? And
What does that really
all
mean?
trials, right?
Mhm.
And so we haven't been able to nail that, but we're going to keep plugging away. And we think we're recruiting basically about 1,000 Black women a month into our trial portal. But so many more of us need it, and we try to help as many women as we can that call us on the phone. Can you help me get a trial and do that? So, we have some great docs like Dr. Mo who can help us source the trials, Dr. Vidal, Dr. Trina. We've got some great doctors, Dr. Fayanju, Dr. Olapati, to help us figure out how we can, get more Black women into science. And you know what? It's not only breast cancer, it's across the board. It's all cancers. And most of the drugs that we have were actually tested on 50-year-old white men.
Wow.
For blood
Yeah.
pressure, for diabetes, for cancer. Yeah. And
And that's why representation matters in the development of these treatments, because the way it may impact one population may not have the same impact in the other. And it's just so important that that they understand exactly how a treatment may work. And it's not bad if it works differently in someone else who didn't study it enough to like really understand that impact. And that's why what you're doing, Ricky, it is such important work. And that's why, at Cancer Support Community, we love you and love working with you and love to amplify like what you do as much as we can, because you can't do it alone, right? It takes a community.
We can't do it alone. You
Yeah.
can't do it alone. We can't, no one fights this fight alone. And we are an alliance because we want everybody to play in the sandbox, like we
Exactly.
can hold link arms and do this work. But this morning I was on a call with two of our Sambai scientists. So, you know, Sambai is our project that we're
I
working.
love that project.
Yeah, with Dr.
When you
Melissa
first told
David.
me about it, I was like, can I come? But
And
only because I just think it's fascinating what you were doing. I
yeah.
actually told my husband about that. My husband's from Nigeria originally, and
Oh,
I
yeah.
just,
Oh, great.
yeah, and I just was so impressed that you're doing this, like you're really doing the work. So I would love to, whatever you want to
Yeah.
tell me, please
Yeah, so
share.
we're working, and Nigeria is one of our countries that we're working in, but I was on the phone with two of our scientists who are both in London.
Mhm.
Actually three, there two are in London and one's at Johns Hopkins. And
Okay.
so they're studying breast and prostate, but we have all this data that's basically validating that a Black cancer cell biologically looks different from a white cancer cell. And that's what
Mm,
Sci is really identifying. And so guess why the drugs don't work? Guess why
right.
Black people have higher mortality rates? Guess why we're getting it younger? Guess why,
Mhm.
like all these things that were playing out, 40% of triple negative breast cancer is women under 40. Did you know that?
I did not. You said under 40?
Under 40. So well before you would have a mammogram, hello, but
Right.
that's where you can help us, because so when I start thinking about those statistics, so how come the policy that we have in place says you can't get a mammogram until you're 40? And so
Mm.
that's where this is an example of how policy is so important, because we need to change that one. We need to
No,
change
you're
that.
yeah,
And
and I know they recently changed, and I don't want to get too in the
it came
weeds,
down
right?
from 50 to 40, but
Yeah, 50 to 40, and then I think there was a recommendation about women with dense breasts not getting, I think it was like an MRI, like it wasn't, I think it was the USPSTF. Don't, I believe that
yes,
was it.
yes,
That
it was.
changed
Yes,
their recommendation,
yes,
right, from
yes.
women with dense breasts getting MRIs, and so
Yeah, but
yeah, that for me personally, because
yeah, and it's funny because
I
then
do have dense breasts, and I
guess
have a
what?
family history of breast cancer, as you know, right?
Yeah,
So
yeah.
this is an
And
issue
we'll get to
that
that in
is,
a minute.
it's not just work, it's personal for me as well. So you're right, those recommendations, to your point, may not be accurate for Black women.
For Black people. And
Yeah,
you know, how do frankly, you don't really know your breasts are dense until you have a mammogram.
exactly.
Okay, the mammogram is what detects it. So if you don't
Mhm,
have a mammogram till you're 40, you don't know that you have dense breasts. And
mhm.
actually all younger women have dense breasts. I mean, they get less dense as you get older, but we're losing this whole group of women who are now dying of breast cancer across races. Much more so with Black women, because they've never had tested. And I guess that the data shows that, and we're going to do a show on breast density in a couple of weeks, but I think the numbers are, if you have dense breasts, you're 3 to 4 times more likely to get breast cancer.
That's what the evidence shows. It is.
Yeah. So
And yeah.
that's scary. But so think about the woman that we're talking to who's 32. She's got metastatic triple negative de
Mm,
novo. Got it off
mm,
the. She never had a mammogram. She didn't know anything about this stuff.
right.
How to test for it. So that's a whole big conversation. But that's an example of kind of policy work that needs to be done. The other thing too, and I'll give you another policy example we're wrestling with, is the FDA put out this mandate about clinical trial diversity plans. And so now
Yes.
they're requiring our pharmaceutical partners to write a diversity plan to get to associate with their trial, to recruit. So how are you going to recruit Black people into your trial, or whoever needs the drug? How are you going to recruit them into your trial? Well, guess what though? It's for phase 3 trials.
Hmm.
So you guys, I've explained this many times to our audience,
No, I
but
love it when you explain this.
but
Yes.
there's kind of 3 phases of drug development. Okay, so phase 1 is usually about maybe only 10 or 15 people, but it's really to see, is the drug safe? Is the drug going to kill you? Is the drug, how toxic is the drug? Is it safe? Okay, so you test it among few people, and a lot of the people that are in those trials are probably, it's kind of their last resort, so they're willing to try it, but still it's for safety and efficacy. And then phase 2, you get a bigger audience and you start thinking about, is the drug safe? Is it efficacious? Is it going to do the job? Is it going to cure the cancer? And at what level? So do you take 2 tablets or 1 tablet or 1 infusion? So you start to think about the dosing of the drug, the safety at the various doses, the toxicity of the drug, how toxic is it at this level? And you start looking at, okay, a little more detail with a bigger audience of people to see, is this killing the cancer? Is it killing the person? You know, hopefully not, but I mean, it's still a safe environment to be in because you're monitored so closely, but it's really just that level. When you get to phase 3, then you're talking to thousands of people, you know, depending on the drug, and you're testing really just to see, is it okay? And you're comparing it to the standard of care.
So phase
And
3 is too late.
so stage 3 is too late. Hello, you got that instantly, right? It's
Yes.
too late. It's too late. By the time you're in stage 3, the drug's in the birth canal.
Mm.
And so
Mhm.
there's a policy opportunity. So, you know, the FDA, they don't want to hear me screaming all the time, but I'm screaming all the time. But yeah, but that's where, you know, stuff where we need people like you to help us deal with issues like this. So how do you go back? And you know, it's the fact that these diversity plans are happening is a good start. It's a good start, but it's not the be all end all, and it's not the right answer right now.
Yeah.
And that's all we have. So how do we change that? How do we bring more conversations around that? How do we get them to start earlier, you know? And so even when we try to work with pharma on specific trials, like I want to be in there at stage 2. I want to be there getting women at stage 2 to help figure out, okay, because also we know that we're having efficacy issues because our mortality rate is higher, but also it could be a great drug, but it's the wrong dose.
Right.
It could be a
Right.
great drug, but we get a different side effect.
Mhm.
It could be a great drug, but we're not using it properly for our biology, right? I'll give
Right.
another example. So we work with Dr. Clayton Yates, and he's just a badass doc. He's an oncologist. I'm an oncologist doctor at Johns Hopkins. He actually grew up at Tuskegee. He's a Tuskegee brain. He's been at Johns Hopkins, and he's doing amazing work. And he's been working in Nigeria for
Oh, okay.
many years. And so immunotherapy, like a drug like Keytruda, has been kind of a miracle drug, you know, and mixedly immunotherapy is when the drug teaches your immune system how to cure itself, how to fight the cancer, right? And so it's been working great with breast cancer. Keytruda has been doing great with triple negative breast cancer and lung cancer, but it's never worked too well on prostate cancer. And so they started digging into the science, like, why is this happening?
Mhm.
And what they found out was, guess what? Immunotherapy, the way the immune system is built, it doesn't work on white prostate cancer. But guess what it works on? Black.
Black.
So we've now had immunotherapy. We've had Keytruda for 10 years, 10 years, saving lives.
Mhm.
And we now are just finding out that it's working on Black men. So we lost 8 or 10 years saving Black men.
Right.
Isn't
Right.
that crazy?
That is crazy.
Because the clinical trials only had white men in it.
And this
So
is why clinical trial representation
it's
is
so
and that's why you hear us working on it, why you hear Ricky
right,
working on it,
right,
because we understand
right.
what it means on outcomes and survivability.
Yeah, so now actually Clayton just fielded a clinical trial with immunotherapy in Nigeria with 60 men on prostate cancer. And still, like, I think it's a phase 2, which is why it's a smaller number, but
But it's phase 2, which I like.
yes, so he is like testing it now to say is how many lives can we save. So it's important to do this research, but unless we as Black people stand up, put the pink boxing gloves on and
Yes.
fight like girls, whatever it takes,
Yes.
these conversations. And so, you know, we appreciate your fight.
And
So
that's why we
yeah,
exist. That's why you exist, right?
yeah,
We
yeah,
continue to represent you, the patient voice, the patient perspective. We always start with what does the patient want? What does the patient need? And we don't pretend at CSC headquarters to know what you, the patient, needs, right?
yeah,
We actually have a cancer experience registry that is open to cancer patients, survivors, and caregivers, where they can share, they can answer questions about their treatment, their decision outcomes, their mental health, their financial health, right? It's like longitudinal, and that's where we get that insights on like what matters to patients. And we do break it down by demographics so that we can distill and break it down and understand, you know, those that are Black African American who participated with the breast cancer diagnosis, what were the quality of life measures that were most important to them. So that's what also drives a lot of what I do at policy. I don't just go in and speak as Deneen, because how dare I go in and act like I know what matters. I go with the knowledge of what our cancer experience registry has given. So I know that my recommendations are informed by like patients and caregivers
So can
themselves.
people go put information in there on your website?
Yes, they can. You
Okay.
can find the
Okay, great.
cancer.
I
I'll
put
share
it,
that
I
link
put
with
it in
you
the,
as
I
well.
put it in the comments. Yeah, great, great, great.
Yes.
Great, great, great. So you alluded to this a few minutes ago, but this is a Mo question, because if she were here, she would ask you this.
Okay.
Um, what's your why? What's your why? Why do you do this work? Why you are so passionate and so, you know, assertive about making a difference? What's your why?
So my why, like she said, I kind of alluded to it a few minutes ago. My why is my mom. I
Mm,
lost my mom to breast cancer. She was 46.
40,
I was 20. I had just turned 22. We
wow.
found out May of 1998 she had breast cancer. My mom was private, an older school Black woman, so she didn't really tell me much because I was in college and she didn't want to get me off. So
Right, right,
I
right,
just
right.
knew, yep, I just knew she had stage 3 breast cancer in May. And my mom passed December 14th, 1998, the day after I graduated from college. So my mom missed my college graduation.
I know.
But I was able to get home the next day. I got home that morning, and so she was in hospice at this point and she was resting. And I walked in and I said, Mommy, I did it. I got my degree. And that was important because my mom did not graduate from college. And she always told me when I was born, when I was a baby, she knew like this child's gonna go to college. And so when I got home, and I ran into the bedroom, and I saw she was resting. I was like, Mommy, it's me. I'm home. I did it. I graduated. And she opened her eyes and, she was just like, she kept saying, my baby, my baby, my baby. And I was like, yeah, Mommy, I'm here. I did it. I did it. And she was like, my baby. And I was like, I graduated. I graduated. And that was maybe 10 o'clock that morning. And after that, she just was peaceful. And 11 o'clock that night, she passed away. But my mom passed away knowing that I graduated from
You did
college.
it. That you did it.
Yeah, and so she is my why, because things were very different in 1998. A lot of advances have been made. My mom was getting mammograms, and her lump was missed. Um, she happened to see it, right? The mammogram a few months prior didn't catch it. And I just wish that I had known about cancer support community, quite frankly, because my mom did feel quite alone when she was going through that. And I wish, as her only child, that I knew that cancer support community had resources for me, that if I needed to be in a
Right,
group
right.
or
To
talk
be
to
taken
someone,
care
I could, because I was
of.
facing that as an
Here's,
only
yeah,
child and trying to
right.
be strong um, for my mom. So she's my why. She's why I'm so passionate. She's why it doesn't feel like work to me. I just do this and hope I make her just proud just a little bit,
Yeah.
and that she knows I keep her alive, keep her memory alive, in what I do.
I asked you your question though. What's your,
Mm.
what's your
We
why?
have to ask that question, and
I
we
know,
have to ask
I
it of
know. I asked
everybody.
you. I'm glad you're here, Dr.
Yeah.
Mo. But yeah, but
Hi,
I asked
Dr.
you a
Mo.
Hey.
question.
So
Did
listen, I'm sorry I'm late. It's 1 a.m. and where I am in Switzerland right now. So
Are you in
um
Switzerland? I knew you were. I thought you were out of the country, girl.
I am. I'm at the World Economic Forum in Davos talking about innovation and early detection and all the stuff. But I didn't want to miss this because CSC is a huge. I was on the board in Philadelphia, Cancer Support Community
I
of Greater
know. Yeah.
Philadelphia. I participated in the documentary that we have out
Yeah.
talking about medical mistrust and earned medical mistrust
We
and the
just
work
talked
that y'all
about that. We're
do.
going to post that on our website. Yeah, I'm not on social
But the
yet.
work that y'all do is so important and is so complementary, right? Like people always say, oh, there's all these different factions, but it feeds into what we need to do because it supports push for clinical trials, right? People don't get to understand why and how to be involved and why we should trust clinical trials without watching documentaries like yours, right?
Mhm.
Touch has a need to talk about, well, what do we support our kids and how do we provide resources in communities across the country? And CSC has resources like summer camps for kids that can help
Right.
them who are parents who are going through this. So like it's such a integrated network of support for cancer patients that I don't think people really understand,
Yeah.
you know?
Thank you for
It's a
saying that.
big word. It's a big word, and that's why it's like when and it's so funny when I said, what does cancer support look like in all of these facets? And they're everywhere. It's all the things. To
And
all
it
the,
continues to evolve, right?
yeah,
Because we talk about things like financial toxicity that we never
yeah,
talked about
yeah,
before.
yeah.
CSC is not new to this. They've been true to this. They've been talking about this before. We talk about things like sex and intimacy. We talk about
Mm.
whatever it is, like support is everything. And
It's
if support
everything.
changes, if what people need changes, then what we do changes, right?
Right. Well,
Everything.
beautifully said, Dr. Mo. Yes,
So glad you're here.
absolutely.
But it's real, and I just think that highlighting the work and the people who are doing it and the why they're doing it is just like that's my jam. So I love that question, Ricky, because
Yeah,
it cuts
I
right
asked,
through.
what did I say? Did I say this is her question?
Yeah, she
Yep.
did. She
I
did.
did.
Yep.
I said this is my normal question.
But it cuts right through anything else, right?
Yeah,
All the
yeah.
doctors and the
Why
scientists come through and they got all that data. What's your why? Why are you doing this?
why are you doing this? And then I was going to ask you a question too about your mom. Your mom got breast cancer at 46, so young.
So she was 45 and
45, and she died
but
at 40.
past that 46. Yeah. Mm-hmm.
So what are you doing as a young mom? You got young babies. You got 4 and a 5-year-old, right?
Did you hear them?
Did they come in the house? I didn't hear
Yeah,
that.
they did.
Bring them on the
Yeah.
screen. Let's talk to them. Bring them on here. They're babies. But
Oh,
like, what are you doing to protect yourself? Like Amanda, my daughter, she just turned 39, but she got a prophylactic mastectomy last February because we have 3 generations, no genetic mutations. But I mean, like, what are you doing as a mama?
yeah. So it's a really good question. What am I doing as a mama? Because it really was a pre-mama, and now that I'm a mama. So before I had kids, right? Because of my mom passing, I didn't want to get tested for the genetic mutation because I was just like, you know what? I don't want to know. What is it going to let me just live my life? After I had my children, I said, no, I need to know. And so I actually, like you, I got tested, did not have the gene, but what my doctors have recommended, I started getting mammograms at 30. Not every year, but I started getting, I had like my baseline mammogram at
Okay.
like 30, and then they're like, come back in 5 years. So it was like 30 and then 35. And then at 40, they said, we want you to start coming every year because of your family history. Now, when I hit 45, they said, what we want you to do is every 6 months, you get a mammogram. And then 6 months after that, you get a breast MRI. And so what I do is I get a mammogram and then a breast MRI and then a mammogram and then a breast MRI. So
You're
that's
very
what I'm doing.
vigilant. That's good. I mean, I think the protocol, Mo's still here, but camera went away, is that you really should start getting checked 10 years before your mom had cancer.
Mhm.
So theoretically at 35, you should have started to get checks every year, but
Yeah.
that's again a policy thing. Like the policy
Mhm.
really clear, and then everybody sort of bringing them into practice however they want. It's up to your
Right.
doctor. I met a guy the other day who works for one of the pharma companies we work with a lot.
Okay.
He's like a lobbyist for this pharma
Mhm.
company. He's in Annapolis, and he's a triplet, and
He's a triplet?
triplet. Isn't that
Wow.
amazing? I know.
Yes.
He's a triplet. He has 2 sisters.
Okay.
And his grandma had breast cancer,
Mm.
his mama had breast cancer, and one of the sisters had breast cancer.
Mhm.
And he had just had a checkup with his doctor. And he asked the doctor, well, I have this history, family history. Oh, you're going to be fine. Don't worry about it.
Really? Okay.
And I said, that is not the case. You had a mama, a grandmama, and a sister, a triplet sister with breast cancer. You are at risk, baby. You are at risk. I'm going to haunt you until you go get a mammogram. And
Yeah.
I've been teaching him.
Has he gone yet?
He hasn't gone yet. Like, if he doesn't go, like, and within a week, I'm gonna go to his house and I
That's
know.
right. I'll
find
go
where-
with you. If he's local,
Yeah,
I'll go with
right?
you.
I'm like, did you hear my story? I'm like, you are,
Mhm, I
you
did.
need to go do this. And I think he has 2 young kids. I think he's in his early 40s. But I mean, even his sister got it young, they're the same age. So
There's a
I'm like,
lot of fear,
but
you
I know,
know.
but his doctor told him you're okay, Mo.
Mhm.
What is
You
that?
know, it's tricky though, because you got a certain subset of people who don't bring me no bad news. I don't want to know nothing, right? And they don't engage. You got a subset of people who engage and they're like, okay, I did my whew, I'm good to go. And then there's some people who do it and they're like, wait a minute, I don't believe that. What else you got? How many more tests you got? What else can I do?
Mm.
And so there's all these different personalities that play into screening and early
I
detection
know,
that
but
we
he was basically saying, telling the doctor, like, do I need to do any, asking the question. And the doctor
don't.
said, oh, you're fine.
You know, I got a problem with that too. And that's a separate issue about, how, what we call it, paternalism, right?
Mhm.
How doctors assume that people are fine based on profiles of things that they have studied or read or have seen. And where we're going wrong with that is we're seeing it in young women, for example, with breast cancer, young men with colon cancer. We're assuming, oh, it's probably just a hemorrhoid. Oh, it's fibrocystic. Oh, it's whatever. Oh, you're good. Well, guess what? These aren't x-ray glasses. And so we have to learn how to assess each
Yeah,
person individually and how
yeah,
to take in new information and how to synthesize this new information into best practices for people who don't fit the classic criteria. Because we used to think cancer was a disease just of aging. And
yeah.
so,
Well, and
anybody
white
who had
people,
anything
and
else,
white people. Yeah,
you're probably okay. And that's not the case anymore. And so I think when, it's a good educational kind of thing for doctors to talk about and for us to talk about with doctors, like what does it take for you to believe a patient? And can we have that conversation?
yeah.
What does it take? And
Mm.
and why don't you? What are the reasons why you don't believe patients when they say X, Y, Z? And to have a real heart-to-heart conversation about it. We should do a show about it, really.
You
And there's
just took
certain
the words
things.
out of, I was literally like,
Yeah,
that's a separate conversation right
that's a
there. And why
separate
don't you
show.
believe the patient?
Why
It
don't you
is
believe
because
the patient? Yeah,
there's certain conversations that happen that turn doctors off immediately. Somebody who comes in with a bunch of studies who don't know what they have, you don't know your diagnosis, but you brought in a bunch of studies and research on something else that's not relevant to you, and now you want me to take the next 40 minutes and go through it? Boom, they're turned off. Somebody who comes in and they're confrontational, boom, they're turned off. And so the doctors, like we bring our personalities to the encounter just like patients do.
right.
And there's reasons why sometimes, and sometimes it's just plain old racism and bias. But a lot of times it's unconscious things that you don't fit the
Right,
profile.
right. We don't fit the
And so how
profile.
do I
Right,
get you to see me, doctor?
right,
How do I
right.
get you to see me?
For
Is the
me, my
conversation.
data, my information, yes.
Yeah,
Yeah,
how do I get you to just see me
My
and believe
experience
me?
is listen to what I say, right? Like how I experience this, how I receive it, internalize it. That matters
Mhm.
too.
I
yeah,
think that sounds like it sounds like a touch and CSC roundtable
yeah,
conversation
yeah.
that
I
we need to
think we
have.
need to work on that, girl. Let's work on that. Get some docs at the table. Let's
Boom.
work on
Let me
that.
know. I'll moderate it. I'll play both
Right.
sides because I
Yeah,
see both sides of it. I've
yeah.
been the family member. I've been the person getting genetic testing and the doctor
Mhm.
blowing me off. I'm like, it's nothing. Oh, you don't need to be here. Oh, you don't need me to educate. You don't need no, you don't need clinical genetic counseling. You know this stuff. No, I'm a patient. Like
Right,
I'm on this side of it.
right.
So I say we do it and sit down and really get real, close the doors, turn the cameras off and
Good.
like talk about it.
Yeah.
Let's do it. You want to do that one or you want me to do it? We'll both do it. Let's just do a joint session, right?
There it is. That's that alliance. I love
Yeah,
it.
we'll do a joint session. We'll do a joint conversation about it. Let's work on that webinar.
Yeah,
Um,
I want to ask you, Denise, and I ask you too, Ricky, but what do you all want to see for this year? What do you hope for survivors and thrivers and for this year? Like what, not just your goal for your organization, but what do you hope that people do different this year?
I hope they see that this doesn't define them and that there is life and they can continue and that they get to decide, right? Like what that looks like for them. And they have they have a central part in that conversation and mapping that out. That's what I want. I want them to know you are a fighter. I want them to know you're here, you have a purpose, you have a story, you can help, not putting it on you if you don't want to, but you can help inspire, someone else through your experience. And that, things might change and things might look different. But one thing I do know is that we as people, we're strong and we adapt, and you will thrive and continue. That's what I want people to understand. And again, I don't want to just like talk about what we do at Cancer Support Community to seem like I'm like self-aggrandizing, but we
No, you
actually have
should, you should
we
bring
we
it.
actually have programs. Like one is called Care Transitions, exactly for this, for adults and for young adults that are survivors and thrivers, and mapping out through some modules, right? Like really like sitting down, mapping out what does my survivorship, what does my journey look like post cancer, right? You know what I mean? Like thinking about diet and nutrition. If there's like a young adult, is there like fertility concerns? Is there workplace, concerns, employment concerns, just like mapping that out for you so that
As
you
there
don't
are,
feel like your life
as
was
there
just
are going to
disrupted.
be.
You know what I mean?
Right, I put that in the comments, care transitions.
I love
Yeah,
that
Cancer
because people don't
transitions,
know
yeah.
when it's safe to go
yeah,
back to work. They don't know how to re-enter the workplace. They
right,
don't know how to ask for help. Let's say
they-
you go back, but you have radiation-induced fatigue
Yes.
and you
right,
can't do your job. You might, realize that you went back a little too soon. But how do you navigate those things that people don't
right.
know?
People don't
Mm.
know, and people are afraid to even talk about it sometimes at work and stuff, and that's why it's so important to have these conversations and have the support groups that you guys even supply. But Mo, I hope people see that we're getting closer to the science. I had a call with Dr. Sheba Ershad this morning, from London. She's at King's Crossing in London, and she's studying the immunology of breast cancer. So she's looking at not only are the cancers different, black and white, but our immune systems are different. And so as Black people, the cancer acts differently with our immune system than a white person's immune system, which is such cool science. And she said, Ricky, I feel like I live in a day where I'm gonna find a cure.
Mm.
So like I feel like um I feel so blessed to be doing this work because I know where the time is now. And so I don't know if it will happen this year, but I feel like now we're in this research space where so much
Mhm.
good thinking is happening. So many scientists are working on it. So many researchers are in play. And we have the opportunity to bring Black people into this research. So that's why I try to work hard every day to get more Black people in these studies, in this research, so that the cure will apply to us when it comes,
Exactly.
And so I think
I
we
love
don't
that,
have
Ricky.
time,
Absolutely.
that I want to make this happen. And we have a lot of, I've been meeting all these smart scientists. Well, I can't understand what word they're saying, but I know things are ticking in their magic brains that are gonna make a difference. So I just want to participate and get us keep us at the table, on the table, in the test tubes, wherever,
Absolutely.
getting our blood drawn, whatever, to make it
Yep.
happen. So we're part of it.
We need to
So
clone you, Ricky, because
that
you can't be
was a
everywhere.
frightening thought, okay?
You do, and both of you do in different and
Oh,
synergistic
yeah.
ways, right? Because CSC conducts research and provides education
Mhm.
on so many of the things surrounding
Yeah,
survivorship, surrounding treatment, surrounding
yeah,
barriers, surrounding,
trials, yeah,
all of, yeah, nutrition, like you said. And Touch is doing the same thing and really heavily focused also on the research and self-advocating for things like, and I use your example all the time, Ricky. I talk about when we trial two doctors, two pharma, and I say, listen, we need to recognize that one, there's a problem when the people who are primarily enrolling themselves in trials are patients, right?
right,
But
right.
two, the
Oh,
very fact that patients are lining up, signing up 10,000 people who are
yeah,
ready to do
yeah,
something. They're ready to
right.
be engaged,
They
right?
want to do it.
So
They
shame
want
on
to do
us.
it.
It's up to us to figure out how to engage them, right?
Right.
Because the timing, we can no longer say, oh, Black women don't want to participate. They don't want to do. No, they listen, they done signed their own petition, right?
They are, yeah,
If they
they
could
sign up.
design their
Okay.
own research
Yeah,
trial and get funding
yeah,
for it and find it, right?
yeah.
So there's an opportunity, I think, like never before, and there's resources to actually do the math We can stop blaming it on obesity and social determinants of health and poverty and,
Right,
black
right.
women didn't breastfeed and all
Yeah.
this stuff here. We go on those panels and you hear it from CDC doctors talking about, well, black
Right,
women they obese and they don't breastfeed.
right, right. Don't
That's
even
not
get
the reason.
no, that's not it. No.
Right.
Mo, I
And
have a
so
new, I
right, we're
got a new,
here.
we're here. And I actually thought of a new argument for helping some of the young women when I try to convince them to do a trial. So I said, guess what? You could get the iPhone 15 or the iPhone 16, or you could get the iPhone 20. Which one do you want? Right?
That's
You're
a
gonna
mic drop
take
moment right
good
there.
care, right? Or you can get the iPhone 20 that you can't buy yet. What do you want for
That's
your
a
body,
mic drop
for your
moment.
cancer?
Yeah.
So that's my new argument. So I'm always
I
trying.
like that. I think that would
So,
resonate.
right. So, but that's what we're giving people. You're going to get the best we have or something better. And for us, the something better is what we need. That's what
Because clearly what we're doing hasn't been working. It's not
hasn't been
working as well as it could be,
working,
right?
not working.
I mean, and thank God
Yeah.
y'all are here and it's working to some degree, but we
Gotta
can do
more,
better.
more
We can
better,
be
faster.
better.
More
Yeah.
better, faster. More better,
That's
faster.
right. Yeah.
GST, DIS,
Let's do it. I love
Yes,
this.
let's
All
do
right, so
it.
I'm looking forward to hearing more later in the year. You got to come back, Denise, and you got
We're
to tell
gonna
us
happen.
how things are going with this summit that we're going to plan or this conversation. I don't care, closed door
Yes.
conversation, whatever you want to call it. But
Let's
we're
do
gonna have
it.
this conversation.
Let's do
I
it.
love it.
Let's do it maybe around ASCO or something. All right. Let's
I'll
talk
be
about-
at ASCO.
Okay, let's talk about this. Okay.
Okay.
All right. I'm sure we get some support to do it too.
Pre and post survey, and
Right.
we'll collect the data. Attitudes about it,
Yeah.
and how do we feel coming out of it? What are your action items and your takeaways?
Yeah. How can we make a difference? So thank you,
Very good.
my sister.
Thank you. Thank you so much for the invitation.
Love you so
Uh,
much.
This was
Mhm.
it exceeded my expectations, It's just
We
nice
never
to
know
be,
what's gonna happen on this show.
it's just nice to be in community. Like I said,
Yeah.
because for me, this isn't just work. This is also
It's our life.
personal.
It's my God job. It's my
Yeah.
God job. It's most
Yeah.
God job. It's your God job.
It is. It is. It
And
gets
you
you
all
out
are
there.
doing something you guys are like trailblazers. You ladies are so
So are you.
respected and you're so awesome. And I just hope you
so
know
are
that.
you.
So are you.
So being
Well,
invited means a lot. Thank you.
I hope you know that, CSC, like I said, is always a partner of mine and an organization that has so many resources that my patients especially take advantage of, but so many do and so many more need to. So I love
Yeah.
that this show is really elevating the programming that you do,
Yeah.
the work
Thank
that you
you.
do, the people you work with, and just more to come.
More to come.
But you look for where to source good information because there's so much misinformation right now.
Right.
I want people who are watching, especially in 2025, to learn to
Yeah.
find the truth, learn to
Right.
source good
And-
information. And
yeah,
you can get
We're always
reliable
gonna
information.
provide it. Yeah.
Cancer Support Community, Touch the Black Breast Cancer Alliance, Triple Negative Foundation, American Cancer Society. Like there's some places you can go.
Yeah.
Tiger Lily Foundation,
Yeah.
Chrysalis Initiative, right?
Yeah.
And get like the real on what's
Mhm.
going on in breast cancer and the resources you need. LBBC, Unite for Her.
Right.
But use these resources and
partners.
take advantage of them instead of just kind of giving ear to TikTok and things that might have what's trendy, but that things that aren't going to impact your survival and your family and your quality of life. Like get some real practical resources on how to go back into
Right.
the workforce,
Yes.
right?
Right.
And what to do, how to navigate with
Right.
fatigue and your diet and all that stuff,
Right.
and how to get
Right.
involved in the trial instead of listening to people say, you don't want that trial, you're gonna get the sugar pill. Like 2025 is for me, is the year of data. Like show and prove.
Fear of data.
Let's
Show
go.
and prove. That's
Yeah.
right.
Yeah. We're getting a lot of traction too on our new site, blacktmbcsanctuary.org. I've seen our new TNBC site, so we'll have those numbers soon. So Mo, next week is the love show, our couples show. So, every year
love
we have to do a love show of like couples that are dealing with cancer. And, I have some great love stories to tell. We'll have some
Mhm.
stories to
I think we
share.
should do a part 1 and a part 2, do the couples and then do the singles, and like talk
I
about
know,
how do you find.
we need to do that. Well, yeah, Haley said we want to do Valentine's Day.
I love that. Yeah,
So-
well, that could be the
so
love show
we're
part 2.
Yeah, that could be
The Love Yourself show.
Love yourself, self-love. I know. So my
everybody
self-love tip for you, and I don't know if you've tried it yet, is going to the Stretch Lab, which I learned about from Ashley Dedman. Go check it out. Go get your body stretched. And the floating, where you go
Oh,
float
yeah.
in the water. Have you seen those?
Yes.
We're gonna get them on the show. Check it out. Do a demo.
Listen, I have a patient who, a dear friend of mine, she's on the board of my farm. She owns a stretch lab in Pennsylvania outside of Philly. And I would
That's-
love to have her on the show to talk about the
Let's bring
benefits
her.
of
Let's,
stretching.
let's bring her.
Yep.
The stretch lab is awesome. Bring her. We'll do that. We'll
Mm.
plan it. Let's plan it. All right.
Okay,
Thank you,
I'll let her
Denise.
know.
Thank you. Thank you. I hope you get some rest, Dr. Mo. It's probably
I know.
close to
Get some
2.
rest. Go to bed.
I'm doing it. I'm going to bed because I got workshops and a breakfast at 7 a.m. tomorrow morning. So I love you all. I hope it's been
Go to bed.
relatable, reliable, and real. That's what we do every Wednesday here on Black Doctor, or Thursday, depending on where you are in the world, because it's Thursday morning for me. But yeah, boom, there it is.
Love. Bless you, love. Bless you, love. Be
Yep.
blessed. Take care.
Yeah, love you.
Bye.
Love you too. Bye.